I'm Marty Hagerman, and I'm back for a second week of a class called Smoking Cessation. My star pupil, Jennifer, is here tonight, and we're going to be talking a little bit about the process of quitting smoking. The decision to quit smoking is a major decision, and it's not to be taken lightly. It's like any other habit. You really want to plan and process how you're going to do it. It's, you know that you're going to feel better, and most people that decide to quit smoking have attempted to do so between 7 to 10 times before they're actually successful in the process. Each time, I think you take a little piece of what you've done in the past that has worked, and you move forward. But what I would like to do is encourage you to continue your journey, because smoking and quitting smoking is probably one of the most valuable things you can do for your health and for long-term age. Smoking, as we well know, people talk all the time about lung disease, but quite frankly, heart disease and vascular disease, meaning veins, is as important a component of quitting smoking as lung disease. Is it just my heart? No, we talked about that the chemicals in cigarettes are very heavy. There's 7,000 chemicals per cigarette, also known at least 50 carcinogens. Jennifer, what's a carcinogen?
Something known to cause cancer.
Something known to cause cancer, and that is correct. Over 50 known carcinogens per cigarette. There's a few added benefits. I spoke to a gentleman the other day that had been a 50-year smoker, and he quit because he did have lung cancer. But he told me, for the first time in 50 years, I can actually taste food again. He said, I think I've burned every taste bud that I had. And he said, you know, it's just nice to be able to taste food, and I forgot how it actually tasted. He was very thin, which is very common with cigarette smokers because they really can't taste food. And when we taste food, part of the enjoyment of eating is tasting. So we talked about the benefits of quitting and why you decided to quit. That has to be a very personal decision. If your family is bugging you about it, if your husband's bugging you, or your wife is bugging you, or your kids are bugging you, that's more of a frustration. But when you finally get up in the morning, say, I hate the taste of my mouth, I hate coughing up all this junk in my lungs, that is your decision to quit. And you will probably be much more successful. Nicotine is highly addictive, we know that. 2 pathways in your brain when you're born, a water pathway and a food pathway, but nicotine within a couple of days makes it its own pathway. It develops receptors that feel as though they need nicotine to survive. So we talked about setting yourself up for success, picking a date that you have made a commitment to quit smoking. And many times people have to think that through for a couple weeks before they do it. But I'd like to talk to you right now and kind of tell me how your week has gone. And I'm not asking if you quit smoking. I'm just asking, have you thought through the process that this is what I want to do and this is how I'm going to do it? So tell me a little bit about that.
Well, so I was here last Tuesday. I said that my quit date was going to be that Friday.
Mm-hmm.
Tuesday was the last day that I bought cigarettes.
Good.
I knew that if I had cigarettes left on Friday, I would not throw them out. So I smoked just enough so that my last cigarette was Thursday afternoon. For Friday, I had lots of teas, so I busied myself making tea. I had marshmallows, gummy bears, just kind of snacking, lots of gum. And Friday through Sunday was okay. Everything was manageable. There were definitely moments where all of a sudden that urge kicked in and it was like, I don't even know what to do with myself right now. I just feel like I'm going to fly through the ceiling. But after a few minutes that passed. This week has been a little more difficult because I'm back to my weekly schedule, working from home, and it's, you know, I still have those kind of reactions where, oh, I'm so bored, or oh, I just finished something. I'll stand look towards the back patio where I would go have a cigarette, and now instead I'll walk to the kitchen, make a cup of tea, I'll take the dog out in the front and walk around with her. So it's definitely just replacing that habit with something else.
I think that everything you've said, so I'm going to recap it just so it's on the video, that you had cigarettes that lasted till about Thursday. Friday you had no cigarettes, and that was your selected quit date. So you had some gummy bears, you had some other candies, you had some tea. We talked about hydration is extraordinarily important. We're rinsing our bodies and getting all of those compounds out of the body. Then you changed your habits up a little bit because there is kind of a trigger and there is kind of a, this is my pattern for the day. This is how I do things. So you did change things up a bit. You took the dog out for a walk, and I'm trying to recount what you've told me, but everything you're doing is right. And it's everything that we encourage you to do. And we do have this book called Clear Horizons, or Clearing the Air, and it is a governmental book. And if anybody has decided to take this class later, there will be extra copies of this book in the Human Resources Department or Foundation Department. And I will tell you, it does help you make a plan. And if you don't have a plan for this, you're not going to be successful. So I know that you said that you smoke when you drive. Are your cigarettes completely out of your car and you're not carrying any in your purse?
I can't stash cigarettes because I know I'll smoke them. Even, like, I remember I would run out when I hadn't quit, and my husband's like, you don't have any anywhere in the house? I'm like, no, if I had them, I would smoke them. Like, I don't plan like that. So
is he being supportive of your decision? And do you think that he would consider quitting if you quit?
Yeah, he's not going to buy, he's like a bummer. He'll bum a cigarette if someone has one.
Mm-hmm.
He doesn't go buy his own cigarettes.
Because we know that if you have communal support, you're going to do better. And when I hear somebody say, my husband's not going to quit smoking, or my spouse isn't going to quit, and they do go outside, but they still have that access to smoking. And so it's just like Weight Watchers. If you have a big chocolate cake in your house and you're trying to lose weight, you're going to eat it. I mean, so good for you. You've done everything right this week, so congratulations. And it does my heart good. And I also thought about you this week, thinking I hope you're having success with your decision. So congratulations. So you did everything right. You got rid of your cigarettes. You got them out of the house. You got them out of the car. And you're thinking through the process. And that's the first thing I said to you. Were you thinking through the whole idea of, if I smoke, this is what's going on. And once I start, it has just started the whole process and cycle again. It is a vicious cycle. And you've set up your support with your husband. So, ching, ching, ching. You got stars on every plan. So I'm going to move on to this discussion, which just absolutely amazes me, that everybody, really statistically right now, most people that are starting smoking are young kids. And they have all of the information and they know the impact, but it's sort of a culture in their family. Or once again, like many times, they hang around with their peers and their peers are smoking and that just seems cool, so they start. But as we discussed last week, it only takes about 3 or 4 days. Those receptors in your brain are prompted, and then it becomes a pathway in your brain, and your body thinks that it needs that nicotine to survive. It says that they're replacing smokers who quit or died prematurely from smoking-related diseases. And smokers not only have the risk of lung disease, heart disease, stroke, and oral cancer, but they have very serious vascular disease. And so we're gonna talk about that. But I call it death by smoking. And once again, it's about knowledge and understanding the process. 1 out of every 5 smoking-related diseases is caused by cardiovascular disease. When we talk about cardiovascular disease, we're talking about the heart and the vessels in the body. But the vessels, the heart, and the lungs are all closely related. I've demonstrated on the board the relationship between the heart and the lungs. Last week we talked about the left side of your chest has 2 lobes. Those are lung lobes. And the right side has 3 lobes. And all of the aeration, or the oxygen passing into your body, goes from your lungs to your heart, and your heart to your lungs. So one side of the heart does one thing and one side of the heart does something else. So there are 4 chambers of the heart, and here's the outline of the heart right here. Okay, so there's a large vessels over here. This is what we call the main stem bronchus. Okay, so if you get bronchitis, this is where the bronchus sits. Okay, so you can see when you inhale up here, if you will recall, we talked about the heat is the heat of a sparkler. So you inhale that into your bronchus, and from your bronchus it goes into your airway. All right? So when people get bronchitis, it's really clear to understand how that happens with smokers. So there's an esophagus, that goes to the stomach, okay? And then there's a larynx, and it sits side by side, and the larynx is attached to the bronchus, and the bronchus goes into the lung fields. So you can understand the heat and the weight of the sediment of the chemicals of the cigarette impact all of this. So if you have a little cold and you're not feeling well and your airway is inflamed, and then you add smoking to it, that inflames it all that much more. And that's why people that smoke end up with bronchitis all the time. Does that make sense? Can you see that visually with what I'm telling you? Okay, so we have the bronchus, but then we also have the 3 lobes of the lung on this side and 2 on the other. We talked about the chemical weight of the chemicals that are in the cigarettes, but also tar, and so in terms of chemical weight, it's not the nicotine. The nicotine goes to the brain, but the tar goes to the lungs, and it impacts all the organs of the body. Every organ is impacted by smoking. But if you will recall, I might have said a little word about something about alveoli last week. And our lung fields are covered with alveoli. And that is where our air exchange takes place. They look like a little cluster of grapes, even though they're really microscopic. They look like a little cluster of grapes. And where that air exchange takes place, the tar settles into those alveoli. So then we have this in the alveoli, and there's no air exchange taking place. So when you see people that have smoked for a long time, what you will sometimes see, a person that's healthy breathes from their lower diaphragm. So they use their lower portion of their lungs. But when people have smoked for a long time, they have to use the top part because the lungs in the base are filled with phlegm, with a black goop, because they can't exchange air there. So you will see people that have smoked a long time, they will sit at a table and they'll bend over like this to smoke, or they'll hold like this because they have to use the top part of their lung, like this. That's how they intake, and that's not normal. And we typically know in the medical field that if somebody comes in and they have the appearance of being barrel-chested, it's typically because they are what we call COPD, or chronic obstructive pulmonary disease. So the pulmonary areas are obstructed from tar and all of those other tissues. All of those other chemicals. The other thing, when you smoke, it decreases the elasticity of your lungs. So when you're young and you're healthy and you take a nice big deep breath in, your lungs go in, and you blow it out, and then, when you breathe in, you expand, and then when you blow out, they deflate, okay? You can't do that after you have basically harmed your lungs over years, because the tissue does not inflate and deflate the way it should. it's kind of flat, and it just doesn't have that pretty pink elasticity to it, and they have a gray tissue color, okay? Now, you've seen my beautiful lungs, so I'm going to erase this, but I'm going to keep the heart up here because this is going to be something that I think is really what I find interesting about the impact of smoking. So we have this nice, healthy, well, I better start again. So, Jennifer, do you have any questions right now? Okay. Okay, so let's just, well, I'll just make a real heart. Okay. So when you're born, you have 2 chambers, and when you take your first breath, these chambers seal off. So you no longer have 2 chambers, you have 4. All right? The lower portion is called the atrium. Excuse me, the ventricles. And this is the atrium. Okay, so now if you get VFib with your heart, it's very hard to stop it, and your heart is kind of just bouncing. And we know that you're not going to be able to push blood out of your heart the way it should be. But if you get AFib, we can usually shock you back into a normal rhythm. Not uncommon with long-term smokers because there's a lot of damage to their heart. And the heart really runs on little neurons and just little electrical responses to make the heart continue to beat. But that's a healthy heart. When we talk about vascularity with carbon monoxide, when a healthy vessel, when we're born, we have healthy vessels, okay? And they look nice and shiny and pretty. The blood flows through them beautifully. And every time the heart beats, it pushes the blood through, okay? So as we get older and we start eating more fats, it will start to kind of decrease a little bit of this really pretty shiny material. It almost looks like Teflon. If you dissect something and you pull the vessel apart, it almost looks like Teflon. It's very pretty, it's kind of a white, and it's got a really pretty sheen. But when people start smoking, the carbon monoxide starts breaking down the cell wall, the vascular wall. And when it does that, when blood is going through it, it gets hung up on a little bit of cholesterol. Fat plaque starts sticking to the vessel wall. When you smoke, it increases the cholesterol level, and so the plaque wall starts to build out like this, okay? And the carbon monoxide is really the big damaging factor here. Carbon monoxide also attaches to red blood cells, and it kicks the oxygen molecule off of the red blood cell. And I think we talked about that last week. But as the blood starts to go through and you smoke more, you start building more plaque. Now, when we see people that truly, they go in and they do carotid exams to see why people are dizzy or they're confused, and we see somebody that's almost occluded because they have a really high cholesterol level. And very commonly, it's hereditary, but also there's other components to building high plaque levels in veins, and one of them is smoking. So if you will recall, we talked about breaking down the vessel and not having that nice elasticity, but now we've built plaque. And in order to push the blood through these plaque-lined veins, the heart has to work harder. It has to work really hard at pumping that blood. So the harder that heart has to work at doing that, the harder it is on the heart. And you know, when you think about how many beats a day, how many beats in our lifetime, when you put a heart to work like that, it's hard on it. Then also, when you decrease the vascularity, you have less oxygen going to your heart. All right, does that make sense? So we call that cardiovascular disease. So the importance of this is not only do we have lungs that are clogged up over here, okay, but we have a heart that's having to work really hard to keep our blood pressure up, so it increases your blood pressure because the heart's working so hard at it. It also decreases the elasticity in your heart, but what's most important is, people have MIs. Does that word ring a bell? Myocardial infarction. And all that means is there's these nice heavy veins to these areas. Here we go. Okay. So one of these veins has now filled itself with plaque. And if a little piece of that plaque is released and maybe either blocks down in here, or if it goes out of the heart and goes into the lungs, that's called a pulmonary embolism. Or if it goes to the head, what is it called? A stroke, right. So we know that smokers are high risk for strokes. They have high blood pressure. They have cardiovascular, which is also a cardiovascular accident, CVA. But this is called an MI. And once that heart muscle doesn't get any oxygen, so no O2, we have killed part of that heart muscle right there. So when they do EKGs, that demonstrates how does that heart actually look? What's going on with it? And when they take a smoker in and they throw an EKG on them, they'll say, well, we see left lower ventricle damage, or left higher atrial damage. So those are all things that are all linked together. This has nothing to do with lung cancer. It has everything to do with how your body works. So, any questions at this point? You're actually very well informed. I don't know if I really can teach you anything. You're a smart girl. Okay, so we know that blood delivers oxygen, nutrients to our body tissues and organs, and without it we die. And our blood vessels are the delivery system. Our blood is our delivery system, and it delivers oxygen to every organ that we have. If you tie a rubber band to your finger and it does not get any oxygen to that fingertip, it hurts. And that is what I'm going to move on to, which is peripheral artery disease. PAD. Inside a healthy, we talked about that. So we talked about, so when nicotine arrives to our brain, it starts the process of increasing our blood pressure, increasing our heart rate, and it kind of gives you that moment of euphoria, but it also releases stored fats in our system. So you have all this fat that's getting out in your body that it's not really supposed to be there, but it's the fight or flight system. So the body thinks that there's something going on because the vessels are starting to work a little bit harder. Blood pressure goes up, heart rate goes up, so this fat release goes into place. When you take your first puff, there is a release of stored fats. The heavy blasts of stored fats released by the nicotine stick to the vessel walls that are damaged by toxic carbon monoxide. Does that sound bad? It gets worse. We recently learned that nicotine itself inside our vessels causes smokers' arteries to harden, which we have already talked about. It hardens the vessel wall and further accelerates the narrowing and the clogging. We've also known about our lungs, but how long do we have before our coronary arteries, they supply our oxygen to our heart, become completely clogged? We know that happens. So we have people that are in and they're getting their carotid arteries cleaned out, but that's only 2, and those are main sources to our brain. And so we know that people are very symptomatic or they would never be there in the first place. Usually they're admitted to the emergency room because at home they're talking and all of a sudden they're not, or their face drops. They become very confused, and that's when that little piece of plaque has been released and it's gone to their body and has caused a little area of their brain to block oxygen to that area. And even we have these nice, beautiful brains, one little particulate that blocks a tiny little bit of blood, meaning carrying oxygen to that area, really impacts our physical, our mental, and our verbal skills. Decreased blood supply also shows itself in wrinkles. I was just reading about smokers, and they have the early wrinkles around their mouth because it decreases their oxygen source to their lips and the skin around their mouth, but it also, because of the heat, if you recall correctly, and it also breaks down the gums in your mouth. Okay, so we pretty much talked about all of this. Reduces the amount of O2 that reaches your body tissues and changes blood vessels and blood cells. What else? It increases the cholesterol. We've talked about that. High blood pressure, blood clot formation, damage to your blood vessels, and ischemic stroke and heart attack. Talked about all of those. And arterial sclerosis, which is, you know, quite frankly, is a devastating disease. When people are really diagnosed with a you betcha, you've got arterial sclerosis, that means their vessels are no longer able to pump blood up and down their legs or their arms or even their heart. So you don't have that nice texture to your vessels again, that nice, clean, pink texture to your vessels. They can no longer pump the blood. So when the blood can't be pumped, and this is particularly important for diabetic patients or diabetic folks, because they have already, the high sugar levels in their body also hardens their vessel walls. And so if you're smoking to boot, I had a gentleman that came in and wanted to take the smoking cessation class, and he was a mechanic, so he stood on his feet all day. Also, he was in a garage, so he was cold, so he didn't tolerate the cold well because he didn't have good circulation, but his legs really hurt, so he was looking at retiring at 50 because his diabetes was out of control, but also his leg pain was so severe. Over time, plaque hardens, we've talked about this, and narrows your arteries, and this limits the flow of oxygen-rich blood to your organs and other parts of your body. Smoking is a major risk due to the release of the carbon monoxide, and remember, it basically makes your cell, the vascular wall almost like sandpaper, so it catches things. So that cholesterol that's going through your body, or the fatty substances going through your body, attaches itself to the cell or the vascular wall, and so it makes it extremely uncomfortable for people. Do you have diabetes or do you have high blood pressure? I don't suspicion that you do. No, but do you know if there's any history in your family of diabetes?
Not of diabetes. My mother's side has actually an issue with low blood pressure. Mm-hmm. So my blood pressure has always been pretty good.
Oh, that's great. That's great. Okay, well, so, okay, we're going to move on to talk about nicotine, the combination of nicotine and carbon monoxide. So that first inhalation, if you recall, 7 to 10 seconds, it's in your brain. And so the carbon monoxide from the cigarette is released. It replaces your oxygen levels because it knocks that O2 off of the red blood cell, and it reduces the ability to transport oxygen to the heart and to the rest of the body.
Is that what carboxyhemoglobin is?
Carboxyhemoglobin, yes, that is. But you usually see it in people that have been inhaling carbon monoxide. Does that make more sense? Yeah. And that's actually how people, and I hate to say this, but that's how people kill themselves, is if they lock themselves in a garage and they breathe that, it knocks all of the oxygen off of their red blood cells. And then they just oversaturate with carbon monoxide. And that is why they can end their lives in that way. I think that this makes sense. The nicotine stimulates your adrenaline and causes the heart to beat faster and raises the blood pressure. And I know we are going over and over this, but I think when we're talking about quitting, you have to think through the process. So the minute you inhale, your carbon monoxide level goes up, it increases your heart rate, it increases your blood pressure, and it makes your heart work harder. all right? Smoking also impacts cholesterol. Cigarette smoke increases the production of LDL cholesterol, and while at the same time decreases the production of HDL. Cholesterol leads to the narrowing and the hardening of the arteries, which prevents the proper flow. We know this, and this taxes the heart. And that's how people end up with long-term smoking, and that's how come they end up with heart attacks. And they've likely had some MIs, and they maybe didn't realize that. A lot of people deny chest pain, and they think, that just can't happen to me. So there's options for quitting, and so let's talk about this week with you. Did you ever feel like you needed something, maybe some nicotine gum, or?
This week I might need it.
Mm-hmm.
I'm thinking just because, I can only change what I'm doing so much. I still have to be in front of the computer working to some extent. And that's the only time it's really, really bothered me as a kind of way to deal with boredom and anxiety and just kind of switching modes after a task, specifically associated with work.
Right.
So I think either some kind of gum or lozenge or something would probably be helpful. Because I ate candies until I was like, oh my God, I can't eat anymore.
Well, then you're not used to having that much sugar in your body, and that, just one of those little pieces of candy has a lot of sugar in it. But have you thought about, like, maybe, we were talking about this last week, that this is a new community for you, which also puts a stressor on you that you're not accustomed to. And we also discussed that we're kind of going into the winter. Have you thought about maybe joining a gym? Is that your thing?
It's not. I've thought about it, or taking some kind of like class, like a yoga class or something like that. But yeah, gym will probably be good.
Well, I'm thinking in terms of setting yourself up for success, that when you're kind of locked into a house and you don't have a support community or a social community right now, that it's really easy to get bored, like you have mentioned to me in the past, and that this would prompt you to get out of the house. And maybe you could roll it into your schedule at home. And that goes again to changing your habits. And I will tell you, I need to change some habits right now. So I really get that, and I know that piece. But I think that you have a couple of things that it would really be helpful for you if you could get out and develop your own community, not just your house and your husband. And it might help you just change those habits and just turn over that I'm going to get out, I'm going to work out. And I don't really like to go and talk with people when I'm working out, but I do know that I feel better. And I'm not one for being there every day, but if I can be there 3 times a week, I'm happy. So set small goals for yourself, but also you should reward yourself. And if I know that you're a reader, if that means a new book or something special in that way, but you have to acknowledge your steps, that that you're making big steps, even being here in kind of a stressful time in your life. So what do you think you could do to sort of reward yourself?
Just making time to maybe leave the house at lunchtime, just not be there, do something else, even if it's just getting a cup of coffee and hanging out at Starbucks for
Yeah. Are you close to downtown where you can walk?
Not, no, not to Starbucks. There is somewhere close by I can walk to and get a
Do you like artwork, or do you like? So I was just thinking about this the other night. Something that you might enjoy at. Oh, Scott, what is that? What is it? The old library that they have the art studio in the basement now, and you can paint and it's through the city.
It's the space. It's the creative space or something like that.
Yeah, I'll remember the name of that, and I will call you this week, because that's a fun place to go and just be a little bit creative. You know, you don't always have to exercise. You don't always have to socialize. You know, surround yourself with something that's really nice. It's really inexpensive. You can make Christmas gifts there. It's not Carnegie. Is it Carnegie? I think it's Carnegie, and it's run through the city. And they have a basement. It's this kind of cool old building downtown that used to be, I believe, a museum. And they've made it into a space that they do art and crafts, and you can go in and just paint something. And then they'll run it through their little cure thing, and so you can make porcelain cups and that kind of stuff. It's a fun thing to do. And the lady that runs it is a lot of fun. She's outgoing, and she's very creative, and you know, that might be something, and I'll look that up tomorrow and call you. But you need to do something for yourself instead of just going and being by yourself, or you know, what have you. Go do something where you surround yourself with something that's really good. So being a newbie in the community, maybe that's an idea. So the other thing is, and I don't think that